Talk to me about health care, Tony. How can we as a nation afford to extend real coverage to our citizens?
One of the myths, again, that I really want to deal with is people keep on saying that there are 43 million people in this country without health care. The number is actually 48 million. And, people say, well, it's, what's the number? That's 5 million people, and I will bet you for those 5 million people it matters, Mike. At the very minimum, we need a health care policy in this country that takes care of every child from birth, actually pre-birth, prenatal care, through the age of 18, at the very minimum. But I would like to think that as I've had an opportunity to dialogue with both heads of corporations and everyday mom and pop workers, that the country is ready for a single-payer health care system in this country. And I want to remind people that back in 1964, when Medicaid and Medicare first came into existence, it was supposed to be a national model for health care. We just didn't complete the job. I think most people on Medicaid would agree, with the exception of what the Republicans did to the prescription drug coverage, it was working beautifully. It was working beautifully. So we've already got a model in place. It's not like we've got to recreate something. Congressman John Conyers and others have some health care proposals. I've studied them. I'm not 100% on board with any particular proposal right now. They all have merit, but the good news is this can get done. This can get done. So why don't we ask General Motors, if you didn't have health care costs, how much easier would it be to be profitable? How about Northwest Airlines and some of the others? Mike, it's just time we take care of our people. It's just time we do what any other industrialized country in the world has done. We are the only ones that haven't done this. It's time to take care of our people, every single one of them, with no bias.